Greetings from Manipal Hospitals, Saltlake, Kolkata. I am Dr. Anup Banerji, a cardiologist in this hospital. Today I shall be speaking on myths and facts in cardiovascular diseases. As we are aware, myths are beliefs which exist amongst us but have no factual background. They can be dangerous if they spread a false message, and we know that myths related to heart diseases, which can be life-threatening, which give no reaction time, can be extremely dangerous and life-threatening to an individual. It is therefore I chose this topic to communicate my feelings and my thoughts to all of you. I hope you shall be benefited from my conversation now onwards. Myth. I'll know when I'm having a heart disease because I'll have chest pain. The fact is quite the opposite. Heart diseases can present without chest pain. It is called silent ischemia, in which the patient has features of heart problems but is not aware of chest pain. It is classically seen in diabetic patients because of autonomic disturbances. Also, there are other symptoms which can mimic chest pain, but the patient can get confused. The commonest is dyspepsia, what they call as gas problem. Next is breathlessness. Next is fatigue. Next is unaccustomed palpitations. Next is swelling of the feet. So all these symptoms can occur in patients without the classical chest pain in patients of underlying heart disease. So therefore, in patients who are predisposed to heart disease with a strong family history, I will keep on repeating this subset again and again. They should take these as warning signs, especially diabetics. Next myth. I am too young to worry about heart disease. The fact is quite different. In the present day scenario, as you are aware, the disease of cardiovascular etiology has assumed tremendous and worrying percentage in the young people because of lifestyle, because of other factors, genetic factors. People who are born in families where there is a presence of heart disease can have heart disease in a younger age group. Therefore, as I say, people who with a strong family history of heart disease, age is no criteria. One should be aware about the presence of heart disease in the younger generation too. Next myth. I'd know if I had high blood pressure because there would be warning signs. The fact is quite different. Hypertension is a silent killer, and one gets symptoms related to high blood pressure only when the story is too late. That is, when complications of high blood pressure affecting the heart, affecting the kidney, affecting the eyes set in. So therefore, what is the lesson? In people who are prone to high blood pressure because of their lifestyle, because of their family history, they should keep on having a periodic blood pressure recording. One should not wait for symptoms of this silent killer to have its bad effects. The next myth. Diabetes won't harm my heart as long as I take my medication. The fact is quite different. First and foremost, diabetes does not come in alone. Diabetes has certain other disabilities associated with it, like abnormal in the lipids, that is called dyslipidemia, presence of high blood pressure, presence of other metabolic disorders which accompany diabetes. So just taking treatment for diabetes is not the answer. So the solution is one should have a proper screening of associated disorders like that of lipids, of high blood pressure, and treat the diabetes with a strict diabetic control. Next myth. Heart disease runs in my family, so there is nothing I can do to prevent it. The fact is quite different. We know of families where one or two members have had heart disease in their young age, but the others have been smart enough or wise enough to take preventive measures to get themselves periodically screened and address the issues of diabetes, cholesterol, blood pressure, obesity and lifestyle, and lead a normal life. We definitely take a history of early death or early cardiac disease in patients with diabetes, but the others can lead a normal life provided they get themselves screened at the right time. Next myth: I don't need to have my cholesterol checked until I'm middle-aged. The fact is quite different. As I told you, heart diseases and those related to cholesterol are occurring these days in younger patients. On the contrary, Indians are more prone to having heart diseases because of abnormal cholesterol. Also, in patients with familial abnormalities of the lipids, that is familial dyslipidemia or presence of certain factors like APO, lipoproteins and all, these people are born with abnormal lipids. On the contrary, the deposition of lipids in the arteries begins at a very young age. So it is not that a normal lipid profile excludes or excuses people from heart disease. Next myth: my heart is beating really fast, I must be having a heart attack. The reality is different. The heart rate scientifically is regulated or is controlled by the demands of the body. As you are aware, when one is exposed to an energetic activity like running, jogging, when the entire system requires a greater heart rate goes up. The heart rate is lowest when one is asleep, and which we call as a sleeping heart rate, a sleeping pulse rate. But the importance of the heart rate is when the heart rate becomes irregular, in which we experience it as sudden thuds in the chest called palpitations, because these irregular heartbeats can be serious. If they are irregular, what we call atrial fibrillation, that predisposes a person to have brain stroke, or certain life-threatening arrhythmias called ventricular arrhythmias, which can be associated with sudden death. So what is the recommendation? If one gets these changes in heartbeats unaccustomed, that is, you are walking and now you are getting these heartbeats when you are walking less, then one should get an ECG or a Holter monitoring, or in the present era, if you are putting on a smart watch, as soon as you get this increase in heartbeat, if you are aware what is called palpitation, you must quickly record it in your smart watch. The next myth: I should avoid exercise after having a heart attack. The fact is very different. After a heart attack, we cardiologists recommend a period of rest, that is, for the healing of the heart. But after this, we recommend a graduated exercise, which is called cardiac rehabilitation, which is advised by either your cardiologist or the physiotherapy department, in which we gradually increase the exercise of the heart. By doing so, not only the heart improves, but the muscles of the skeletal system as well as the entire body gets a beneficial effect. So it's a myth that one should keep on lying still after a heart attack at home. On the contrary, in doing so, in avoiding exercises, there is a tendency to put on weight, which also against the heart. Next myth: cardiac arrest and heart attack are the same thing. The myth is different. Cardiac arrest is when the heart stops beating at all, and heart attack, as we know, is one of the causes of cardiac arrest. If the heart attack is not treated urgently, scientifically, then this can lead to cardiac arrest. Cardiac arrest can also be revived, so can heart attack be managed. But cardiac arrest is the end point, which is called the cardiac standstill. There are other causes, but heart attack is one of the causes. Next myth: if someone has a fast heart rate, it just means they are stressed or are drinking too much caffeine. No, there are other causes of increased heart rate, thyroid diseases, drugs which cause increase in heart rate. So, all causes of increased heart rate are not necessarily because of the heart. Next myth, vitamins can prevent heart disease. There is a lot of talk and there is a lot of purchase over the shelf of vitamins, antioxidants to prevent heart disease. The fact is that there are no evidence-based trials which have shown that consumption of any vitamin prevents heart disease or increases longevity. Vitamins have other beneficial actions, especially in people who are deficient in their vitamins, and as we all know, a better source of vitamin is the dietary vitamin in the form of fruits and vegetables rather than what is consumed in the tablets. So vitamins per se do not have any evidence-based benefit of reducing heart disease. The next myth, I have smoked for years, there is no point stopping now. This is a very pessimistic attitude. The fact is absolutely different. It has been seen that people who stop smoking today have a 50% reversal after 1 year, and after 10 years they are as good as those who have not smoked at all. So smoking, as we know, does only harm to the heart. If we have the determination to give up smoking, we are as good as those who have never smoked in their life. So there is hope and hope for smokers. Next myth, heart diseases only affect men. The fact is absolutely different. These days we are seeing that there is an increase in the incidence of heart disease in women. As we already know from before, women after the age of 65 or after attaining menopause, or those who have undergone hysterectomy, that is the removal of the uterus, are as equally predisposed for heart disease, if not more. Furthermore, in the present era where we find women more stressed because of their jobs, because of their occupation, because of the increased stressors in their life, their risk factor has also increased. Also, the presence of obesity and metabolic disorders, if any, amongst women increases the risk factor. So therefore, women have to be respected when they come with symptoms of heart disease. Next myth, 2 or 3 hours of vigorous exercise per week will ensure heart health. The fact is entirely different. As we all know, we recommend 150 minutes of graduated exercise in patients of heart disease and otherwise to prevent. Let me also mention at this stage that unaccustomed exercise can be very harmful for people, those who have unknown or undiagnosed heart disease, or those who have risk factors for heart disease. People who are planning to go to the gym for unaccustomed exercises, or those who are going to go to high altitude areas, to the mountains or the snowy peaks, should get themselves screened by any cardiologist or any medical facilities by a baseline ECG, a echo and a treadmill, because unaccustomed exercises can lead to sudden cardiac death, and we have seen enough of them, be it religious functions, social functions, or sudden bursts of activity in the gym where a young person has had sudden death. Next myth, bypass surgery and stenting will fix coronary artery disease. The fact is entirely different. We know of many people who underwent a successful bypass, but they did not give their old habits of smoking, alcohol consumption, missed out on their medications, did not control their lipids and sugar, and therefore had another heart attack. Angioplasty and bypass is just putting the clock back. It is a local treatment of a systemic disease. What I mean to say is, when a person undergoes angioplasty, that area of the artery is so-called made healthy or normal by putting a stent, increase the blood volume. But the stent does not have any effect on the atherosclerotic activity, on the inflammation of the heart, on the metabolic milieu of the person. So it's a local treatment of a systemic disease. One should not have any misconceptions, and therefore, what do I say? After your bypass and after your stent procedure, please continue what the cardiologist tells you as far as lifestyle medication and the consumption of the drugs, and repeated monitoring of your metabolic parameters by blood tests and whatever is advised. The next myth: taking a daily fish oil supplement can help prevent heart disease. The reality is different. Fish oil, and that too a variety of fish, can supply only omega-3 fatty acids. Only taking fish does not prevent heart disease. And let me mention at this juncture, when I speak on oils and cooking and cardiac diet, I will speak again on that. The worst thing that one can do is to fry the fish at very high temperatures, to use oil which is stored, which is not fresh, and therefore all the beneficial activities of the fish oil go haywire. So having a fish oil supplement does not reduce the risk of heart disease. Next myth: if someone is thin, they do not need to exercise to stay healthy. The reality is absolutely different. Well, obesity is a risk factor, but remaining lean and thin does not guarantee you of a sound cardiac health. Especially if you have family history of heart disease, especially if you have family history of diabetes, hypertension, or undiagnosed congenital causes which can make you have a heart attack. So staying lean is of a benefit, but it does not guard or guarantee you. You must get yourself screened if you are in that high risk group. Next myth: I don't need to undergo any cardiac tests before going to hot or cold environments, which I have mentioned before. We are seeing a lot of patients losing their lives, so one should be honest enough and go get yourself screened before that. I hope I have been able to convey a few important things, and we all wish you sound health and a happy, healthy life ahead. Thank you.